Thinking about both your experience of being an undergraduate student in your 40s, a master's student later, and a doctoral student in your 70s and 80s, what have you learned about ageism in higher education, both thinking about yourself, other students, faculty, supports? What can you share with us about your experiences in ageism?
Well, I think my experience in ageism in higher education, I really I didn't feel ageism. I worked with, I think maybe in the undergrad studies, there was a bit more ageism in the fact that the university itself was not very comfortable for older adults. And so there was, the catering was all toward the traditional fresh out of high school students. And so as older adults, there was no place we could go. There was no way you had a say in your education. And certainly the voices of the older adults were not heard. So we really did have to do something about that, and we did. And we started a new organization on campus called Mature and Part-Time University Students, MAPUS. And that still exists today, and it's still giving older adults a voice. So that, but when it came to grad work, it was different. There didn't seem to be any ageism that I experienced, but there was ageism that my committee experienced, the faculty. And things like, you know, why are you wasting your time with an older student? She's never going to get to use it anyway, sort of thing. So my committee were very capable of standing up for themselves, and they always responded back very strongly. So.
Wow, that is so, it's so interesting to think about just kind of those the different targets of ageism, and that people were respectful of you at the graduate level in particular, of you and your learning trajectory, but it was actually the faculty members who had to justify this, which is quite, it's sad, right? It really does represent.
It is, but you also had to, even in the graduate studies, you had to defend yourself against your own peers. You know, they too were saying, why are you putting yourself through this? And, you know, they just didn't understand that no matter what age, if you want to learn, you should have that opportunity. And yes, you don't have as many years left after you graduate, but at least you can make a difference. And just during my PhD, before we were finished, we actually did have social change happen, where the minister responsible for seniors did actually develop a new program for seniors based on what she learned from coming to our open house. And that was pretty exciting.
Extremely. And I did mention that to the students who are here today because I'm aware a little bit of that story and the impact you've had. You know, just kind of reflecting, Olive, I wonder if it takes us back to a period of time when academics might have to have defended women, you know, spending their time on women, because it's shocking. And I think it indicates how socially acceptable ageism is. I don't think that a faculty member, if you take any of the other isms that we're concerned with today, sexism, racism, ableism, there wouldn't be that type of having to defend oneself. So I don't know if you could reflect a little bit on that, and then we could move on to another question.
Well, I think ageism is very ingrained in our society. And so we have there hasn't been a lot of push. I mean, in reality, what we're doing is being prejudiced against our own future. And we really have to do something about it. We have to change the way we think, act, and behave toward other people. toward older people and start looking at them as an individual who has strengths, capacities, and something to offer. So I think it's just, I think it's going to happen, and it's just starting. I mean, the World Health Organization has recently released a new report on ageism. So I think that is a good guideline for us as well.
And I wonder, Olive, linked to that, something that I was hoping you could share with us is, what are the types of things that you've been doing since you've completed your doctoral studies, and maybe how some of those do link into this need for change?
Well, I really have been very busy and very involved, doing a lot of presentations, but also I've been doing quite a few presentations on campus, virtually. And so doing it in a variety of ways. Sometimes the students have watched Never Too Old, and then I would come in and answer questions. Other times it's, I've been involved with an intergenerational study that was happening in Scotland. And at the moment, they're waiting to see if they can get more funding to do further research around intergenerational work. It's certainly been proven that intergenerational activities are one of the best methods of reducing ageism, because all of a sudden you're working together on something, and nobody even thinks about age, but they value what everyone around the table has to offer. I remember one time walking across the campus when I was an undergrad, and this young woman was walking with me, and she turned to me and she said, "You must think we're really dumb." And I said, "No, it's the total opposite. I think you guys are so frigging smart. They seem to know so much more than I did at that age." So, I certainly could see the value of the younger people and the new ideas. So I think we do have to build solidarity between our generations and make sure we have a world for all ages.
Hear, hear. Those are wonderful insights. Could you tell us just a little bit more about the study in Scotland, whether, first of all, what your role is, whether you're part of the research team or participating, and just kind of what some of their activities are?
Okay. What it was actually to look at what is happening around, I think there was 9 countries involved. I was there as a representative of North America, and the student who had invited me to be involved, I had met her at a gerontology conference, and she was a graduate from the University of Victoria, and she was in Scotland doing a postdoc, and this was her postdoc. So they were looking around to find out what was going on around the world, and Scotland is doing quite a bit of work with students and older adults. In Canada, I find a lot is when they talk about intergenerational, they are talking about bringing kindergarten students into long-term care facilities. And for me, that is just enhancing ageism, because they're teaching these very, very young children that being old is to be sick or to be ill and not able to do things. So what this study did, it was just to find out what's going on, and then to see if they can get further funding to do an actual research. So there's a lot of good stuff happening in Scotland. There were some countries involved who were quite surprised that people could actually ask to have things happen. Some of the programs that I really liked was the programs where, you know, older adults and had extra space in their home, and students could get a decent rent by maybe doing something for them throughout a week. And there was such great friendships developed. And also in Denmark, it was where younger people were taking older adults out for drives on bikes. And it just, everything seemed to be so much fun. I think anytime you try to do work with intergenerational people, it must be beneficial to everyone. And it must be something that everybody cares about. And, you know, it can be gardening together. It can be learning new skills together. And I know a lot of times we look back at computers and say, okay, this is how or generations can work together. But there's so many other things that we can learn from each other. So